There are so many activities that can help relieve depression also, but a lot of times, unfortunately, when you're depressed, you're not able to engage in that. And so one of the things that I commonly recommend is trying to increase activity levels, such as through exercise, and really trying to find support groups with other folks who are also coping with depression in order to learn strategies. Psychotherapy, particularly cognitive behavioral psychotherapy, has been shown to be very effective in terms of relieving depressive symptomatology. And so what that type of therapy does is it really identifies negative automatic thoughts that people experience in response to stressors during the day and helps them to really consider alternative ways to think about situations and identify more positive coping skills. So for example, one thing that people tend to do is they catastrophize. If something negative happens, then they tend to really spiral in terms of thinking of all the negative implications. So for example, a student may make a failing grade on a test. If they catastrophize, what they do is they start saying, well, this means that I'm not good enough to be at this college. I'm probably going to fail all my tests now. Then I'm going to drop out. And then I might even be a homeless person because I can't support themselves. Well, obviously, it would take a lot of steps to go from being a college student with an F grade to being a homeless person not able to support themselves. And so what they do in cognitive behavioral therapy is to really talk about perhaps identifying that, number one, you have a tendency to catastrophize, and what are some other ways that we can think about this in order to make it less negative in terms of self-critical processes. Perhaps, well, this is one tough grade, but on the other hand, I can work hard in order to be able to improve the grades, and I'm going to work harder and learn, and this is a challenge, and I will try to do better next time. But this one grade is not a reflection of my overall performance as a student. So I think that can be very helpful for people to actually utilize in addition to taking medications. But independently, cognitive behavioral psychotherapy has been shown to really help patients with depression and help them be able to improve some of the significant symptoms of depression that are so impairing.